Hi everyone. In this video, we're going to cover all the most important things you need to know about taking Vortioxetine, also known as TRINTELLIX. We're going to cover side effects, who can't take the medicine, how it works, what it's used for, dosing, how long it takes to start working, what to monitor while taking it, and some special considerations I think are important to know. My name is Mattias Hartmann. I'm a physician associate, board certified in psychiatry, and I work full-time in psychiatry. I make these videos for everyday people like yourself who want to better understand depression, depression treatments, and medications. Let's get started first with the TRINTELLIX side effects. The only common side effects greater than 10% that I could find on UpToDate was nausea at 21 to 32. This is definitely something that can be difficult to manage sometimes, but if it can be managed, Vortioxetine does work really well for a lot of people. There is another side effect, sexual side effects. Let's go over that on the next slide here. It showed up as less than 10% on UpToDate. We'll talk more about it. But let's go over these less than 10% side effects. So dizziness showed up at 8 to 9%. Diarrhea, 7 to 10%. Dry mouth, 7 to 8%. Constipation, 5 to 6%. Vomiting, 3 to 6%. And here is sexual dysfunction. On UpToDate, it showed less than 2%, less than or equal to 2% in females, 3 to 5% in males. It's actually a lot higher than that. The other source I have here shows minimal side effects at 10 milligrams, which is about the starting dose, but about 44% at over 10 milligrams. And a lot of people do need to go over 10 milligrams. So I would take what it says there on UpToDate with a grain of salt. It's probably a lot higher than 2% or 3 to 5%. It's closer to upwards of 40%. But it does seem to happen, the sexual side effects, I mean, they do seem to happen a bit less when compared to other medicines like selective serotonin reuptake inhibitors. And the last, less common side effects, strange dreams can happen in 2 to 3% of people. Next, let's go over the rare but dangerous side effects. Seizures can happen. Mania can happen. Vortioxetine does not cause people to have bipolar disorder. But in people who already have the genes and are predisposed to bipolar disorder, meaning they're going to show signs of it at some point throughout their life, Vortioxetine can trigger them to have a manic episode. So that's why it's not given to people with bipolar disorder usually. And suicidal thoughts can happen. It's rare. It's about 1%. And I do have a whole video on this side effect. So if you are curious about it and want to learn more in depth, be sure to check out that video. So who can't take Vortioxetine? In whom is it contraindicated? If you're taking a monoamine oxidase inhibitor, MAOI, if you're taking that medicine, it's contraindicated. Don't take TRINTELLIX, because it can cause serotonin syndrome. And of course, if you have an allergy to Vortioxetine, then don't take it. So how does Vortioxetine, also known as TRINTELLIX, work for depression? It mainly works as a selective serotonin reuptake inhibitor, just like many other medicines like Zoloft and Lexapro and Prozac and many others. But Vortioxetine, or TRINTELLIX, also has many other mechanisms. And so it's considered a unique medicine, and it's really in its own class. So when someone doesn't respond to, say, Lexapro, which is a pure selective serotonin reuptake inhibitor, then oftentimes we'll think, okay, what other mechanism can we use that's different? Vortioxetine is that medicine because it has so many different mechanisms, and let's go over them. So it blocks 5-HT3. 5-HT just means serotonin. So it blocks this serotonin-specific receptor. It also blocks 5-HT7. And blocking this receptor is thought to cause the improvements in cognitive benefits that one sees with Vortioxetine. It's one of the only medicine that causes this improvement in thinking, improvement in inattention. As you may know, depression, one of the core symptoms is inattention, trouble focusing, trouble concentrating. So this medicine can directly improve that as well. It also activates 5-HT1A and it weakly partly activates 5-HT1B and 5-HT1D. So it actually has quite a complex mechanism. A lot of these mechanisms here aren't exactly known what they do exactly. Some of them are theorized to improve with certain things like depression, certain things like anxiety, and some of them aren't really known. But what we do know is that this is a unique mechanism, and so when someone doesn't respond to one certain medicine with one certain mechanism, then trying a different medicine with a different mechanism is oftentimes really helpful. Let's go over the uses for TRINTELLIX. What are the FDA approvals for TRINTELLIX? Well, major depressive disorder, also known as depression, also known as unipolar depression. It's FDA approved for that, and that's its only FDA approval, but it's also used for other things as well, like generalized anxiety disorder and other anxiety and depression conditions. So how is TRINTELLIX dosed for depression? Well, the starting dose is 10 milligrams once daily, and you can take it with or without food. It doesn't affect absorption. And the usual dose range, meaning where most people need to be to notice improvements for depression, is 5 to 20 milligrams daily. So actually even lower than the starting dose. Some people just don't need that much because they metabolize medicine differently. And the max dose for TRINTELLIX is 20 milligrams total daily. And how long does it take for TRINTELLIX to start working for depression? Well, 2 to 4 weeks usually, and that's pretty consistent with most medicines for depression, like sertraline, also known as Zoloft or Lexapro. Usually most of them are going to say this as well, 2 to 4 weeks, but it might take up to 6 to 8 weeks, and that's pretty typical. Is there anything you need to monitor while taking TRINTELLIX? Answer is no, not if you're a healthy individual and you don't have any medical problems. All right, and lastly, let's go over the special considerations for Vortioxetine. It helps improve thinking ability, so it improves cognitive speed, and it does it similar to taking or drinking like a half a cup of coffee. So about 50 milligrams of caffeine, that's about the amount of cognitive improvement that you'll notice when you're taking Vortioxetine. There are no withdrawal symptoms. I mean, usually, never say never, right? But basically, there's no withdrawal symptoms because the half-life is so long. When the half-life is so long, like 3 days, the medicine basically tapers itself off in your body, so you don't usually get withdrawal side effects if you stop taking it. So that's nice. You don't need to adjust the medicine for any kind of kidney problems. There's lower sexual dysfunction versus other antidepressants. That's true. It causes them less, but like we saw earlier in the side effect profile, it's still prevalent, especially above 10 milligrams, about 40+% above 10 milligrams. And it has a different mechanism than other antidepressants. So basic antidepressants like selective serotonin reuptake inhibitors like Prozac, Zoloft, Lexapro, Luvox, all of these work primarily as serotonin reuptake inhibitors. Vortioxetine has a unique mechanism because it has so many other receptors, serotonin receptors, that it hits on. So if someone doesn't respond to one antidepressant, trying one with a different mechanism like TRINTELLIX is a great idea. And it has the lowest risk of weight gain, so among antidepressants. So it's in the category of minimal to no weight gain. So if people are worried about that, that's another benefit. And it's not known to cause any kind of sleepiness. If you enjoyed this video, be sure to check out this video on screen on Prozac, also known as fluoxetine, which is also a first-line antidepressant treatment for depression. I'll go over everything you need to know in that video. I'll see you over there.